Life Lab is incredibly impressive. I think it's very cutting edge for the University of Southampton to be doing Life Lab, because I think it is at the cutting edge. I think, we know that you've got to have the resources, you've got to have the programs, the interventions, the supply, etc. But increasingly in many disciplines, health and others, we're seeing that only gets you so far unless you address what sometimes you might refer to the demand side, so the behaviours, the health-seeking behaviours, the way people engage, the health experience they have when they engage. Does that encourage repeat health-seeking behaviour, etc.? So I think Life Lab's at the cutting edge in terms of thinking about, behavioural change, and then does that lead to broader sort of social norm change that might underpin how people see themselves or those in their family and what health they're seeking.
And so what they've seen, what we're doing, they've seen the attraction of this youth brand, they've seen how youth are really engaged with it, and we've engaged not just adolescent girls, but boys and their parents.
What Girl Effect does is build brand platforms to actually change how girls see themselves and how those around them see them, so to change the social norms around adolescent girls. So we think of the girl at the centre and issues, whether it's health or education, violence, economic empowerment, safety. We see the girl at the centre of all of those issues, and we believe that if we can change how a girl sees herself and believes in herself, and how those around her, who actually often control what she does, how they see her, then she will have access to all of those things.
Actually, that thinking turns to action. So both for the girls, the boys, the father, the mother, those around, the imam, the priest, the teacher, those who actually control in a community environment and a family environment what happens to adolescent girls.
We start with a lot of insights. We start with a lot of hours with adolescent girls, understanding the environment that they live in, both at the family level, the community level, the wider societal level, to understand what supply of services, health clinics, schools, what is available in the community and the country that she lives in, and the landscape of media, etc., that exists there. But critically for girls, what their hopes and dreams and aspirations are, as well as their fears, etc.
Her family was there, her grandparents were there, they all gathered together, and she was told she would be married in 48 hours' time to a man who was twice her age.
And if you give a girl agency and belief in herself and change how those around her value her, then they will let her go or proactively seek opportunities for her to have health-seeking behaviour, or to go to or stay in school, and to not go through some things like early marriage, early pregnancy, etc., which happens to so many girls in developing countries.